be part of the Austin ISD family, but never more so than after seeing your strong commitment to the safety of our students over the past 2 weeks. We are extremely grateful to be participating in AISD's virtual option this fall after having immense success with virtual school last year. However, my heart has been heavy with worry for the teachers and students who will be back in the classroom without mask mandates as recommended by the CDC and AAP. AISD has set the bar high for safety standards, including commitments to HEPA filters, air purifiers, social distancing, lunches in classrooms, contact tracing, and close contact communication. However, I want to extend my strong support for AISD to partner with other Texas school districts to use any means necessary to challenge the dangerous and reckless executive order banning mask mandates. Thank you.
My name is Reese Palmgren. I'm an 8th grade at the Amateur School for Young Women Leaders. I'm calling about agenda item number 6, COVID-19 safety protocols. I would like a mask mandate for all AISD students, faculty, and staff. Last year's safety measures were effective, and I would like them in place this fall. AISD said they are committed to following science. It's been proven that wearing a mask can help prevent the spread of COVID-19. Requiring masks will help protect our entire community. As a student, I encourage AISD to stand for the safety of our community. Good leadership means protecting others and speaking up for them. I feel relieved there's a virtual school option this fall for my brother, who is at higher risk for COVID-19 complications, so thank you. I know that if there were a mask mandate in place, it would reduce the risk of bringing COVID home to my school and affecting my little brother. Thank you, and you have my appreciation.
Hi, my name is Audrey Ferentz. I'm a parent of 2 under 12 kids at AISD. They go to Zilker, and I'm just asking you to please push back on Governor Abbott's refusal to let us have a mask mandate in school. My kids were digital learners last year, virtual learners, and it was great. Their teachers did such an amazing job, but I really wanted them to go in person this year because, that's, you guys know, that's the best way for them to learn, but I'm really scared about Delta. We don't know, but everything that we're seeing, it looks like it's going to be even worse than last year. We don't know what the long-term outcome of COVID is on kids, and having masks just seems like the very least that we can do to keep our kids safe. And, okay, thanks for listening.
Muy buenos días, mi nombre es Luzari Montoya. Tengo 2 niños en el distrito, uno en 7º grado y otro en 4º grado. Quisiera que apoyaran los requerimientos de máscaras en la escuela, por favor. Estoy también en el campo de la salud. Los pacientes con los que trabajo son niños que tienen deshabilidades muy fuertes y médicas. Y si mi niña va a la escuela y se pega el coronavirus, eso va a afectar a mis niños, va a afectar a nuestra familia económicamente y financieramente y emocionalmente. Yo sé que ustedes van a reconsiderar esto y los apoyo en cualquier decisión que tomen. Muchísimas gracias por todo su trabajo. Le agradezco mucho. Que la pase muy bien. Adiós.
This is an interpretation into English of Luzmari Montoya's message. I wish you a very good morning. My name is Luzmari Montoya. I have 2 kids in the district, one in 7th grade and another in 4th grade. I would like for you to support the requirement of masks in school, please. I am also in the healthcare field, and the patients that I work with are children with very serious medical disabilities. And if my daughter goes to school and gets the coronavirus, this could affect my children. It will affect my family economically and financially and emotionally. I know that you will reconsider this, and I support you in any decision you make. Thank you very much for all your work. I am very grateful. Have a very good day. Goodbye.
Hello, my name is Caroline Tipton, and I have an incoming 1st grader at Cassis, and this is in regards to Item 6, COVID safety protocols. I'm calling to implore the district to stand up for what is right for our community and our kids and mandate masks in elementary schools. Whether other kids wear masks will affect the likelihood of my child contracting COVID. Until there is a vaccine for our elementary kids, we need to do everything we can to make schools safe, and that includes masks. As others have said, you're not my child's doctor. but all doctors have been clear masks are effective. Yes, we would like to say that we can all be personally responsible for our kids, but in this case, the choices of others affects my child. I can send my daughter in a mask, but the better protection is the people around her also wearing masks. This is not as simple as my child, my choice. It's more like my child and my choice affects other children. Thank you for listening. Goodbye.
My name is Joanna Wynn. I am calling regarding agenda item 6 for tonight's meeting. I am the parent of an incoming 5th grader at Matthews Elementary. I'm also a nurse who's worked in healthcare for over a decade. I am calling to voice my support for AISD to implement strong COVID-19 safety protocols, including mandatory masking for all students and staff for the beginning of the upcoming school year. I really feel until vaccines are available for children under the age of 12, we must do all we can to protect students, teachers, and staff. We don't yet know the implications of the new variants and long COVID on children, so we must do all we can to help keep them safe. I am committed to supporting the board and the district for as long as necessary to ensure the safety of our community. I appreciate your time and consideration. Thank you very much.
My name is Izzy Williams-Andani. My 3 children attend AISD, and 2 of them are too young to be vaccinated. I am also the former Director of Risk Management at Austin ISD. I'm calling about agenda item 6 regarding COVID safety protocols. Please take immediate action to institute a mask mandate for all students, faculty, and staff. AISD made it clear at this week's town hall that the district is committed to following science. Please follow the guidelines of the CDC and American Academy of Pediatrics. I know that mandating masks means defying the governor's order, and I want to assure you I will be there to support you if there is a pushback from this decision. As a former Director of Risk Management from your district, I understand being a servant leader is a difficult position to be in, but please step up and do the correct, moral, and safe thing, even if it means going against the stream of some political streams. By mandating masks in the schools, please help protect our children. Thank you for your time.
Hi, I'm calling about item 6, COVID protocols. I'm Adam Dommoyer, father to 3 AISD students. My oldest are vaccinated, but my youngest is only 9, so he'll attend virtually. Thanks for offering that, by the way. I know the TEA didn't want you to, but took guts. Back during stage 2, I actually thought my youngest would get to go in person, but then Abbott mandated no mandates. I know there are those who say my kids can still choose to wear masks. Theirs just shouldn't have to. But this airborne contagion doesn't play like that. The proof? Many of the unvaccinated stopped masking, and now we're running out of hospital beds. So because I don't want his brothers bringing a breakthrough case home, I ask you to stand up for public health again. Put a mask mandate in district-wide until all kids under 12 can be fully vaccinated. Local control is a conservative principle, so Abbott should understand, and if he doesn't, parents like me will stand up for you. Thanks.
Hello, my name is Richard Kelly. I am a graduate of Austin ISD, a parent of an Austin High School freshman, a teacher at Austin High School, and I live and vote in Geronimo Rodriguez's district. I just wanted to call to say how proud I am of the board. That's not something you expect to say when you vote for candidates or even knock on doors for them, that they have inspired you. I am so proud to work and live and be a product of a district where our board is willing to fight for our students by considering this mask mandate tonight in defiance of the governor's orders and doing everything in your power to find virtual options. I should add the superintendent to that list as well. And I just wanted to call and offer my support and encourage you to keep pushing and doing what you can to keep our kids safe and keep our community safe, and know that you have our support as you go forward with this. Thank you very much.
My name is Maggie Stens. My daughter is going to be a senior this year at Austin High. I'm calling about agenda item 6 regarding COVID-19 safety protocols. Please take immediate action to institute a mask mandate for all AISD students, faculty, and staff. AISD made it clear this week at this week's town hall that the district is committed to following science, and the science is clear. The simple act of requiring masks will help protect our entire community, especially given the alarming rise in cases over the past several weeks. I know that mandating masks means defying the governor's order. I want to assure you that I will be there to support you if there is pushback for this decision. We want students to go back to school this fall, but they must be able to do so safely without endangering themselves, their families, or our community. Masking and vaccinations are the only way to do this. Thank you for all that you do. I know this is a hard job, and you have my deep appreciation.
Hello, my name is Christy Donmoyer. I'm calling about item 6, COVID safety protocols. I'm the mother of a McCallum Fine Arts Academy junior, a Lively Magnet 7th grader, and a Baranoff virtual 3rd grader. I'm writing to ask you to please stand up to Governor Abbott and his anti-science order and require masks for Austin students. My 9-year-old, Emmett, has sacrificed 15% of his childhood to stay safe at home. I'm terrified that after all that he has given up, his brothers may bring COVID home to him. Even if they're only mildly ill, thanks to vaccines, with his comorbidities, COVID could be severe for Emmett. We need your help to get to the finish line, his turn for a vaccine, so that he has that extra and most important layer of protection. I know going against the governor puts you at risk. Please, let's have each other's backs. If you go out on this limb, you will have my support and the support of many families in dealing with the consequences. Thank you.
Hi, my name is Dara Chambers, and I'm calling about item 6, COVID-19 safety protocols. I'm the parent of 2 elementary students, and I ask that you take immediate action to institute a mask mandate for all AISD students, staff, and faculty. All medical experts agree that aside from vaccination, masking is the most effective way to protect our entire community. My son has asthma and a history of pneumonia. Both of my children receive special ed services, and while I appreciate the hard work that went into virtual learning, their needs were not met last year fully. However, we cannot put their lives at risk by sending them to school if masking is not mandatory. I beg you to take whatever action is necessary to make sure that our kids can return to school as safely as possible. Several more months of isolation and virtual learning would be devastating for them. We will do everything we can to support you if the state takes action against AISD for requiring masks in our district. Thank you for all that you do. I know that this is a hard job, and you have my deepest appreciation and support.
My name is Jen Margulies. I'm speaking on item 6, COVID-19 safety protocols. I'm the parent of an incoming 6th grader at Keeling. First, thank you for all you're doing to ensure a safe start of the school year in the midst of the spike of a COVID variant that's worse than anything we've seen. The state of Texas is expecting students and adults to head back into school buildings with even fewer protections in place than we had last year, when the Delta variant is more contagious and affecting more young people than the strain of COVID we dealt with last school year. As a parent of a kid with some pre-existing health issues, I'm very grateful to AISD for putting a virtual option into place this semester. But I'm also deeply concerned about all the people who are going to be in our school buildings. Despite your best efforts, without a mask mandate in place, everyone in our school buildings remains at high risk. The CDC recommends indoor masking for everyone ages 2 and up, including students, teachers, staff, and visitors, regardless of vaccination status. A mask mandate will protect kids, teachers, staff, families, and our public schools. This community will support you in following the science and putting in place this common sense safety measure. Thank you.
Yes, my name is Janet Jansen, and I would like to address Agenda Item 6, COVID-19 safety protocols. I've been an AISD parent for almost 20 years. My younger son graduated from McCallum High School in May, so I'm contacting you today as a concerned voting constituent. I'm asking that you do everything in your power to make this school year as safe as possible for our students, especially those that are too young to be vaccinated. AISD staff and AISD families. I applaud the actions that you have already committed to, including contact tracing and informing parents of positive cases, but we must go further while we were in stage 5, and we need a mask mandate. The vast majority of Austin residents believe in science and know that we must prevent the further spread of COVID-19 in our community. We will support you in the measures you deem necessary to protect our children, AISD staff, and our community. Thank you very much for your service. I know that the actions of the state government have made your job more difficult, but I ask that you have the bravery that you need to have to.
Hi, this is Rob Janko regarding item 6 on the COVID response safety protocols. I'm a father to a young boy about to enter his second year at Summit, and we are now facing the reality of keeping him home for another year of virtual learning. It's not our first preference, nor should it be what we have to do in order to advocate for his safety and the safety of our extended family. Like so many others, we spent 2020 turning things upside down to support him through virtual learning. We're blown away by the execution of the Summit staff. But given that resounding success, we know that an on-site education would mean so much more. Immersive experience in the classroom instead of Zoom grids, camaraderie of spending days with classmates rather than in isolation, the empowerment he'll feel knowing the institution will back him as he takes responsibility for his safety. This is why it's essential to provide the foundation of a mask mandate on campus. In addition, we require lunch to be taken in the classrooms or outside to reduce transmission risk. We look to you for your leadership and influence to make safety our first priority and protect the privilege of in-person education. We stand ready and committed to support you in mandating these policies so that we give our children the best that our schools have to offer. Thank you.
My name is Stephanie Miller, and I'm a parent of a rising junior at Anderson High School and a rising 8th grader at Murchison. I'm writing to request that you act now to require masks for all AISD students, staff, and faculty. Both my children will be attending school, in-person school in the fall, but I'm extremely hesitant given the current increases in COVID cases. My rising junior has asthma, and I'm concerned about his health in a school where masks are optional. While 65% of Anderson High School parents will require their children to wear masks, peer pressure will take over. Many of those teens will remove their masks. I've seen it at band camp this summer, where at the beginning of the camp, most kids were wearing masks inside the hall area, outside the band hall, but 2 weeks later, there may be only a handful. The band director can remind them, they can't enforce them. The science is clear. The simple fact of requiring masks in AISD schools will help prevent not just my students, but our entire community, especially given the alarming rise in cases over these past few days. I'm aware that taking this action means defying Governor Abbott's order banning such mandates. I promise you that I will be there to support you if there's pushback for this decision. Thank you for your work in our community. I'm sure it is a challenging responsibility, even in normal times, and especially right now. Thank you so much.
My name is Catherine Dombrowski, calling about Item 6, COVID-19 safety protocols. I have 2 children at Davis Elementary. Please mandate mask wearing in Austin ISD. Parents are hearing 2 pieces of advice. 1, in-person school best children, and 2, all persons in school should be masked. The governor's order banning mask mandates is inflicting psychological trauma upon me and the other 80% of AISD parents who want our children masked in school. Our children know they are being sent into an unsafe classroom. As a parent, my hands are tied. I cannot make others wear masks, but the hands of the school board are not tied. You can be our voice. You can stand up for student safety and for true personal liberty, the liberty to enjoy a safe learning environment and a supportive community where we all watch out for each other by wearing masks. The state is not acting with integrity, and it is not acting in the best interest of our children. We must fight back to reclaim a safe and reasonable world for our children.
My name is Lori, and I am a parent calling about Agenda Item 6, COVID protocols. Thank you for providing a virtual learning option for my second grader and our youngest learners who can't get vaccinated yet. However, it is not enough. Your responsibility is to provide a safe learning environment for all students. You can do this by providing a virtual learning option for all grades and requiring masks in schools. Please take immediate action to implement a mask requirement. I know this defies the governor's order, and you have my full support. Please also consider mass COVID testing for staff, students, and their families before school starts and on a regular basis. AISD leaders, I care about our community. Please make learning safer for all this fall with district-wide virtual learning, masks, and testing. Thank you.
My name is Karen Blaze. I am the mother of 2 Austin ISD students and a voter. My call is regarding item 6, the COVID safety protocols. I'm pleading with you to take quick action to enforce a mask mandate for all students and adults in Austin ISD. My youngest child can't be vaccinated yet, and I'm concerned for her and others' safety. The city of Austin is in an emergency situation due to rising COVID-19 cases and the Delta variant. Our hospitals are overtaxed. Our ICUs are full. AISD families need action from you to keep our community safe. We do understand the implications of defying the governor's executive order, but we want you to know the AISD parent community will support our boards fully in their decisions to keep our kids safe. Masks save lives. Help us save the lives of our precious children. Please vote to enforce a mask mandate for all in Austin ISD. Thank you.
My name is Jean Potter, and I'm calling regarding item 6, COVID safety protocols. I'm a parent with a first grader in AISD, and I'm pleading with you to take immediate action to institute a mask mandate. She can't be vaccinated yet, and I'm worried about her health and well-being during this Delta variant surge. At the time of this writing, there are only 6 available ICU beds available for an area of 2.1 million people. Emergency situations require decisive and strong actions. I understand the implications of defying the governor's executive order, and I want you to all know that you will receive full support for any decisions you make to protect our kids. The consequences are clear. Without a mask mandate, our already dire situation will just get worse. If it saves even one life, it will have been worth it. Please do the right thing today.
Caroline Sweet, beginning my 17th year of teaching with AISD, calling regarding the item 6.1. For many years, you've asked me to be brave. You've asked me to be brave as I practice getting 24 fourth graders into a bathroom. You've asked me to locate in our hiding spot anything with which I might fight off an active shooter. You've asked me to be brave as I think about what would happen if there was some sort of extreme danger and my class was on the playground. I've discussed with kids how we would run into the woods, hide by the creek, all of us together avoiding danger. You've asked me to be brave and come back to work during a pandemic after surgery and 6 months of chemotherapy for stage 3 cancer, and I have done it, and I will do it, and I will show up, and I will get in that closet, and I will look for the path to the woods. Board members, you don't have to do these things, but just as I will be brave and think about how my body might shield children from danger, I ask that you be brave today. You know what you need to do to protect children. Do it. Implement a district-wide mask mandate and vaccine requirements for students and staff.
Hello, my name is Rhonda Ware, and my daughter will be attending 3rd grade in person at Kiker Elementary starting August 17th. I am calling regarding agenda item 6, COVID-19 safety protocols. I am reaching out to request that Austin ISD mandate masks for students. I am making this request because children my daughter's age and under 12 cannot be vaccinated. Breakthrough cases are increasing. Our ICU beds are low in Austin and throughout Texas, and we are at stage 5 in Austin. We're at a crisis stage. Having a mask mandate is the only way to keep our children safe in schools. Thank you for standing up for the health and well-being of our children. We are committed to standing with you as you make this life-saving decision for our children, teachers, and staff. Thank you.
My name is Devin Peck. I'm calling regarding agenda item 6, COVID-19 safety protocols. I'm a parent of 2 Austin ISD students, and I'm also a physician. Our community is in crisis. The current surge in COVID cases has increasingly affected our community's children. In the week ending July 29th, the number of reported cases of COVID-19 in children almost doubled to nearly 72,000 cases. Some of these children require hospitalization and even critical care. The CDC, the American Academy of Pediatrics, Texas Medical Association, Texas Pediatric Society, and multiple other physician groups agree that the best way to keep children safe in schools is with a multi-layered approach that includes masks. Masks work best when all parties are masked. While some may say they have a right to decide whether or not to give their child a mask, the reality is that we all have a right to safe schools for our children. I urge the board to support a mask mandate in our schools in defiance of Governor Abbott's reckless and inexplicable executive order.
Hi, my name is Heather Rell, and I'm calling about agenda item 6, COVID safety protocols.
Thank you for meeting today. I wanted to call in support of strict COVID safety protocols. I'm a parent of a kid at Summit Elementary and one at Lively Middle School. Please enact a mask mandate to keep our kids safe. My incoming fourth grader, who is not low risk, I will be keeping home. Thank you for providing a virtual option. I've been agonizing over where to send him all summer. The virtual option was wonderful last year, and I'm looking forward to his schooling this year. For my incoming sixth grader, a mask mandate and strict COVID protocols will allow her to attend her magnet in person. We don't want to risk her getting sick with COVID or bring it home to the rest of the family. She wants to go. She worked hard to get into her magnet. Please put these measures in place so we can send her to school. We're seeing pediatric hospitals fill up. Keep our kids safe and enact mask mandates and strict COVID protocols. You have my continued support. Thank you again.
Good evening, ASD board members. I'm Tom Nyland, proud parent of a first grader at Brentwood. Today I'm speaking up for my unvaccinated and innocent son. I'm also here to tell you that the stress we AISD parents are feeling across the district is palpable. This Delta variant is running rampant in our community. And while 80% of AISD families stated they would send their kids with masks, it's not good enough. The science is clear. CDC, the American Academy of Pediatrics, say everyone in our community should be wearing a mask indoors. And the politics of state leadership is also clear. They're not trying to offend any science deniers to gain their votes. You, board, you are our last hope. I'm asking each and every one of you to be courageous, to be bold, to protect our children. Please vote for a mask mandate. We as parents are going to fully support you and have your back if you vote to protect our children. Thank you so much.
My name is Bill Fagelson, and my son will be a junior at Austin High this fall. I'm calling about Agenda Item 6 regarding COVID-19 safety protocols, asking you to please take immediate action and institute a mask mandate for all AISD students, staff, and faculty. The science here is clear. The simple act of wearing masks will help protect not just my student, but our entire community, especially given the alarming rise in cases over the past several weeks. Although my most immediate concern is for my son, who has had past problems with his immune system and whose mental health continues to be affected by isolation from friends and peers, and concern for their safety. As an educator myself, I worry about the physical and mental health of all students, staff, and faculty in our schools. I am aware that taking this action means defying Governor Abbott's order banning such mandates, and I commit to being there to support you if there's pushback for this decision, which I expect there might be some. Thank you for your continued work in a difficult job that is, I'm sure, especially challenging right now.
Hi, my name is Elise Lerner. I'm calling about Item 6, COVID-19 safety protocols. I'm the mom of a rising first grader at Brentwood Elementary and asking you to please approve a mask mandate for our school. As you know, Austin is in stage 5. The Delta variant is raging and our hospital and healthcare workers are on the brink. You should also know the CDC guidance is that kids should wear masks to school, especially those who are too young to get vaccinated. If you don't implement this basic safety guidance, you can't claim to care if our kids stay healthy or fall ill, live or die. You can't claim to care about our community knowing that when kids start falling ill, our businesses, healthcare system, and society eventually will grind to a halt. I have friends who are opting for virtual and pulling their kids out of ASD for concerns for their kids' safety. I don't want to do that because I want to support public schools, but the support must go both ways. You need to support our kids and our communities. Our kids are vulnerable and their safety depends largely on the actions that you take today. Honestly, I'm begging you to do the right thing and mask up. Thank you.
Hello, my name is Alicia Treveria, and I am calling as an AISD parent regarding Agenda Item 6, COVID-19 safety protocols. I am a proud and dedicated public school parent of 2 elementary students, and I want to thank all of our trustees and staff at AISD for working hard to protect our AISD families and our community against so many obstacles. As a high-risk household, we are terrified to send our kids back to school in the midst of the Delta variant wave, and Austin is in stage 5. Our children aren't able to be vaccinated, but they desperately need to return to school after over a year of isolation. I've seen my loved ones suffer lifelong effects from other diseases like polio and measles, and I know that vaccines and masks are our key to prevent this generation of kids from having to endure similar lifelong effects. While we await the vaccines, we have to ensure that everyone who is medically able to wear a mask on campus does so.
We need AISD to come through for us and to trust that we will have their back if they do. Thank you for your work, this meeting, and the chance to speak.
Hi, my name is Allison, and I am speaking with regards to item 6 on the agenda, the COVID-19 safety protocols. I am a parent of 2 AISD elementary school students. I am also a cancer survivor and a double lung transplant recipient. I urge you to propose a mask mandate for AISD schools. I plead you to do this for our children who cannot be vaccinated yet and those with high-risk family members like myself who were vaccinated but did not make antibodies against the virus. I know that the district has been put in a very difficult position and the legal and financial risk of going against the governor's orders is high, but please note that the stakes are higher for people like myself and others in the community because for us, the stakes are life and death. It is frightening to me that we are crossing our fingers and hoping that 20% of the unmasked school population will be enough. We are crossing our fingers that personal responsibility is enough to protect us. But by the looks of the current spread of the Delta variant and the state of our local hospitals right now, I can tell you sadly that it will not be enough. Merely hoping that people will wear masks will not be enough. Thank you so much for listening to my concerns.
My name is Barbara Passmore, Agenda Item 6, COVID-19 Safety Protocols. Hello, I'm a parent of a pre-K and a first grade student at Becker Elementary in South Central Austin. Please take immediate action for safe school reopening, including a mask mandate, contact tracing, and enhanced safety protocols, including for lunch. Please consider delaying the first day of school. I understand it's politically and financially scary for you to take this step, but I will support you if you stand up for Austin's children. As I'm sure you do, I worry for my kids. I also have a baby at home and a husband with an autoimmune disorder. It was scary last year. This year is worse. But further spread of COVID when schools reopen on the 17th is just not necessary. The governor is wrong here, and we can't wait for him to rectify his mistake. Too many children will get sick, bring COVID-19 home, and too many will die. So please let us follow the science. Thank you.
Hi, my name is Jennifer Lyon. I am a parent of 2 daughters at Russell Lee Elementary School. They both receive special education services there. As a voter and a parent of current AISD students, I appreciate you stepping up to protect our students, taking the courageous step to keep our students safe at school, and your important efforts to save lives in our school and our community. We appreciate all of you and the opportunity to have this meeting today and have our voices heard. We are in stage 5 with increasing cases, ICU at capacity, and a Delta variant. We know that the adults and children are dying, and we know that there are many, many long-lasting effects of COVID, the full extent of which are unknown. We also know that masks help prevent the spread of COVID-19, and we are asking that AISD mandate masks in school and continue to provide a virtual option to help keep our staff, teachers, children, and community safe. Thank you so much.
Hi, my name is Ryan Douglas. I am the father of 2 children in AISD, one in Murchison Middle School and one at Hill Elementary. And I'm calling to comment on item 6 about COVID protocols. I would like to encourage the board to consider enforcing mask wearing in schools and or delay the start of school to try to ensure more safety. I'm really concerned about the likelihood of spread in the schools right now with having lunches even spread apart with plexiglass, still having a bunch of kids in the same room for 30 minutes seems like a kind of a risky situation at the moment. And then having a mix of masked and unmasked kids is kind of scary to me as well right now. So please consider doing everything you can to enforce having everyone in the school wear masks and figuring out how to manage this Delta outbreak and maybe waiting on certain things, either the opening of school or certain activities until the spike has passed so that things are a little bit safer. Thank you. Bye.
I am Roxanne Evans, longtime AISD volunteer and taxpayer, calling on item number 6. Hello, board members and Dr. Elizalde. I am here today to thank you for calling this important meeting and to strongly urge you to take the next step to mandate masks for AISD staff and students. Anyone following the science of this deadly pandemic knows that masks are one of the best tools we have to fight COVID, especially for children too young to get vaccinated. Student safety is one of the district's top priorities. Thus, a mask mandate is consistent with AISD policies to protect the health and safety of students. I realize that going against the governor is a bold step and can create anxiety. It's unfortunate that you're in this position. School boards are elected to make decisions in the best interest of students, not get caught in political crossfire. But please be assured that myself and others will support you if you do the right thing and mandate masks. Thanks for your courage and your willingness to put the safety and well-being of our students ahead of politics.
My name is Hannah Rabin. I'm the mother of 2 Austin ISD students. I'm calling about Agenda Item 6, COVID-19 Safety Protocols. Since March of 2020, we have worked with AISD to support our kids through virtual school and back to in-person learning last year, but we cannot support a return to school without a mask mandate. There is absolutely no evidence that masks are harmful, but there is overwhelming evidence that when everyone is masked, we all protect each other. Masks are especially vital for elementary schools where the entire student population is unable to get vaccinated. It is our responsibility to protect our children. Returning to school without a mask mandate disregards the current understanding of COVID-19, ignores the surge in our own community, and is counter to the recommendations from AAP and the CDC. Returning to school without a mask mandate risks the lives of our children. It teaches them that science is irrelevant, that education is unnecessary, that expertise is meaningless, and that critical thinking is not actually critical. It teaches our children that their health, their safety, and their lives do not matter. We need you now to advocate for our children. We implore you, take bold action for school and student safety. Follow the recommendations from AAP and the CDC. Show our children that their lives and health matter. Thank you.
My name is Jenny Berger, and my son is a rising junior at Austin High. I'm calling about Agenda Item 6 regarding COVID-19 safety protocols. Please take immediate action to institute a mask mandate for all AISD students, faculty, and staff. AISD made it clear at this week's town hall that the district is committed to following science, and the science is clear. The simple act of requiring masks will help protect our entire community, especially given the alarming rise in cases over the past several weeks. I know that mandating masks means defying the governor's orders. I want to assure you that I will be there to support you if there is pushback for this decision. A few years ago, our son had a virus-induced rare blood disorder that left him without platelets, severely limiting his activities and upending his life. For his mental health, he needs to be back in school now and to know that adults are fighting for all students. For his physical health, he must have those around him masked. Thank you so much for all that you do. I know that this is a hard job, and you have our deep appreciation.
Daniel Regal, with my baby girl, 9-month-old Marion, Agenda Item Number 6, COVID-19 Safety Protocols. Good evening, trustees. I'm a parent, community member, and district volunteer. I'm calling to urge you to protect our children by imposing a mask mandate. Undisputed scientific evidence shows that the new COVID variant Delta is far more contagious than earlier forms of COVID. We already know it's more contagious than even chickenpox. In recent days, Delta has caused an enormous increase in local hospitalizations. On Friday alone, there were 109 new admissions for COVID. 7-day average is now 78. Most disturbing, Delta is causing significant harm to our children, our most vulnerable populations, many of whom are not yet eligible for a vaccine. The number of hospitalizations to our children is rising dramatically. Furthermore, children who contract Delta, even if they are not hospitalized, are at risk of experiencing long COVID with lingering physical, mental, and neurological symptoms. The district has a moral, legal, and fiduciary duty to protect our children. I urge the district to implement all public health policies necessary to curb COVID-19, including a mask mandate. Thank you.
Hello, this is Anna Thiele. I'm calling regarding Item 6, COVID safety. Teachers and staff are responsible for our students. We have trained for how to best serve the needs, and we would never want to see our students' health compromised or their families. In 2020, kids were at home online learning because of the pandemic and rise of cases. What is different in 2021? We still have a pandemic and a rise of cases. We lost a teacher to COVID. Custodians tested positive. And only 2 weeks before school, my campus has already had 6 letters informing that there was a positive case on campus. And this is before we all stepped foot on campus. To not be masked on campus is so irresponsible for our students, their families, and that we as teachers cannot stand for the lack of care from our governor. So we rely on you to protect our students. Also, we do not want to lose another staff member to COVID because of the unvaccinated or unmasked. You are the school board. Are you taking care of us? Look at Garland ISD, just 1 week into school without a mask mandate, and 600 plus students and 30 teachers now with COVID. Please do what's right. Thank you.
Hello, my name is Ilya Yachman. My daughter will be starting 6th grade in undergraduate school. I'm calling about item 6 regarding COVID-19 safety protocol. Please take immediate action to institute a mask mandate for all AISD students, faculty, and staff. AISD made it clear at last week's town hall that the district is committed to following science. And the science is clear. The simple act of requiring masks will help to protect our entire community, especially given the alarming rise of cases in the past several weeks. I know that mandating masks means defying the governor's order. I want to assure that I will be there to support if there's pushback for this decision. The health of our children, our community, and our already strained healthcare system is at stake. These model courageous leadership and science based on decision making. Thank you for all what you do. I know this is a hard job, and you have our deep appreciation. Thank you. Bye.
My name is Laura Grinnell. I'm a parent of 2 children, as well as a retired educator and administrator within AISD. I am regarding to item 6. We've heard many times the successes of last year. However, many of these reasons for the safe success was due to the layered prevention strategy put in place. Now, with several of these layers gone, they're scientifically proven to keep all of our community safe. No masks, if no masks are there, if no temperature checks are there, if the use of the check-in app is not there as well, we can currently not brag about these successes any longer because they will not be replicated this year. Houston ISD is the largest school district in our state. They've taken a huge step to stand up for our entire community and theirs as well. It is time for you to follow their courageous lead. This is not a time to be selfish and think about our children or our choice. It is a time to think bigger, to think about our entire community. Its basic infrastructure is in need, and mandated masks in schools are part of that. Masks work. You have proof from last year. Masks save lives. And I don't think anyone on this board or anyone in this district, whether it be a parent or someone else, wants even one child's life to be.
Hello, my name is Dan Matko. My daughter is a senior at Austin High. First of all, thanks for having this meeting. I appreciate your service. My comment is brief. I highly recommend that you consider implementing a mask mandate before school starts, so everyone could now have an emergency meeting to vote on this. Additionally, I ask that you implement a vaccine mandate for all Austin Independent School District staff. It's the only way that we're going to be able to keep a safe environment for our children and for our staff. And if you do this, I will support you against any battles with the governor, because frankly, the governor is crazy and he has a death wish. This is just horrible. Thank you again. Please, 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 please have a mask mandate and a vaccine mandate for everyone at Austin ISD. There's staff and a mask mandate for our kids.
Trustees, this concludes our public comments. Are there any questions or clarifications for the administration regarding any of the public comments? Trustee Anderson.
Dr. Elizalde, I noticed a lot of callers mention mental health. Is it I was looking on the website, is it a possibility of putting that mental health tab back on the front page of the website, even though you go into 3 little clicks, because I've messed around with it since sitting up here, but just know I've heard each and every one of you. I've read the emails. Mental health. I mean, I'm sitting up here full of anxiety myself, but I do read your emails. I do, and I appreciate it. Thank you.
Thank you, Trustee Anderson. Trustees, any other questions or clarifications for the administration? If not, we will now recess the open meeting at 6:09 p.m. and move to executive session pursuant to Texas Government Code sections 551.074, 551.072, 551.073, 551.087, 551.076, and 551.071. For purposes of this video meeting, the board will now leave this open meeting, which will remain live online and convene privately in a separate meeting. When we're finished with our executive session, we will reconvene here. And again, we thank you for your patience. We will now reconvene the open meeting at 7:23 p.m. and we will be going back to executive session after the next presentation. Tonight, the Board of Trustees has called a special meeting to discuss safety protocols. School starts for students next Tuesday, August 17th. The City of Austin and Travis County are currently in an unprecedented emergency with rising COVID cases and hospitalizations, especially for those who are unvaccinated in Austin. For our first item, we would like to welcome Dr. Desmar Wachs, the Medical Director and Health Authority for Austin Public Health. Dr. Wachs will be sharing a current state of COVID for the greater Austin community. And Dr. Wachs, we can't thank you enough for being here tonight.
Thank you. Thank you for having me. Can you hear me?
Yes.
Good. I'm going to give you a presentation on COVID. This slide shows the curve as it was on the 8th, but I'm going to give you the numbers for today because I prepared it ahead of time. Currently, we have 445 individuals with COVID-19 in our hospitals. Our 7-day moving average for hospitalizations is 83. We have 551 people hospitalized with COVID-19 in our hospitals right now, 191 in ICU. We have 116 on ventilators with 74 admissions and 56 discharges in the last 24 hours. If we look at the age breakdown of the patients that are admitted, we see that there's been a marked increase in admissions over the past few weeks. The largest increase has been 450% increase in the ages 30 to 49. And I'm going to break down the pediatric cases on the following slide. When we look at our pediatric cases since the beginning of the pandemic, we see that we had peaks in the number of cases in the July surge of last year and earlier this year. And we can see that that was highest in the 10 to 18-year-old range, with fewer in the 1 to 9-year-olds and very few in the less than 1-year-old age range. And we're seeing that now as of June. We had a big jump from June to July with higher numbers of cases in these past few weeks. Looking further at this, we see that the hospital admissions for pediatric cases, again, as I said, rose from June to July. There was a 209% increase in the number of admissions, with the highest numbers in the 12 to 17-year-olds. We've also seen that in that age group, we've seen more cases overall that we've related to extracurricular activities such as strength and conditioning training camps, volleyball, and other types of camp activities during the summer months. If we look at our pediatric admissions between June and July, we see that we had fewer admissions, very few admissions in the month of June, and then in July we had a big increase in those admissions, again in that 12 to 17-year-old range. Almost all of these were unvaccinated, and a number of the ICU admissions were related to children with chronic medical conditions. And if we look again at pediatric admissions since the beginning of the pandemic, we see that the admission numbers rose between March of last year and December of last year. And we're seeing higher numbers just between January and August of this year. If we And again, if we look at these overall case numbers, we see that from March to December of last year, we had 7,019 cases. And in the period of time from January to present, we've had already 7,438 cases. And that is if you look at just looking at our June and July case numbers, which total to 1,599, that's 22% of the total number of cases that we've seen thus far this year. So this Delta variant's impact on our case numbers in the pediatric population is quite significant. And again, this is looking at our positivity rates, which have increased. And as we know, anything over 10%, we're starting to look at a high transmission rates in our community, which is evident from our curves that we've been looking at. This slide shows data that's been collected. There's a numbers issue. There's a gap in reporting related to not getting information from all people that are admitted to the hospital. But we do see from this that we have almost all of our patients that are admitted are unvaccinated.
Dr. Watts?
Yes?
Hi, this is Lynn Boswell. I'm sorry to interrupt you, but your slides aren't updating and the information.
There we go. Sorry, there we go.
Okay, good. I want to be sure that we're getting the information you're sharing. Thank you very much
Thank
and sharing
you.
it with the public.
Thank you.
I appreciate it.
Thank you. Thank you. Let me go back to show the previous slide. This is our positivity rate, which is we're seeing here is going up in over time and is evident from our high transmission rates in our community right now. And this is looking at our hospital admission stats for those who are vaccinated. And we see that they're fully vaccinated account for this, as this slide shows, 15%, and the rest are unprotected, partially and not unvaccinated individuals. I want to go to some of the modeling information that you may have already gone over with Dr. Myers, just to look at the status quo and moderate compliance with masking and vaccinations, but particularly with masking, and the impact of high compliance of vaccinations and masking on what happens with our ICU capacity. And this is being done based on a virus that's not the Delta variant, previous variants that we were dealing with in previous surges. And if you look at what happens when we are impacted by the Delta variant, we see that those numbers go up dramatically. Previous slide showed numbers in the 1,100 range at the peak. If you look at our Delta variant, you see that the number is much higher, somewhere close to 1,900 or thereabouts. And when we start implementing masking and other non-pharmaceutical interventions at a moderate to high compliance rate, we see that the curve flattens. And with high compliance, we see that there's, we're not overwhelming our ICU capacities. And that is true with school starting with masking. And it almost is lined up with not having school opening. So we see that masking really does impact our numbers significantly. And this study was using some of the data that was collected in a German study where they showed with 90% compliance, they had approximately a 50% reduction in that climb of the curve. And So I show this to show that if we do implement masking, that we can have a favorable impact on the number of cases that are impacting our ICU system. And I'd like to go back to the original slide, which, as I said, is showing our data over time. And we see that in these two instances, we did not have the impact of vaccinations to work with, and they were just started. We just started deploying vaccines in this time frame. So the vast majority of this decline in the surge was because of our use of non-pharmaceutical interventions. There was some impact from vaccine, but largely at this point, we were vaccinating healthcare workers and our elderly. So I show this to show that masking, social distancing, hand washing, and staying home when sick are things that we've used before successfully to reduce the spread of COVID-19 and to prevent severe illness, disease, and ICU admissions to hospitals. We are now faced with a new variant, and these same things will protect particularly our younger children who are not eligible for vaccinations at this point. And I support this body's going forward with masking and contact tracing for those cases that are identified as positive in your school systems. Last year, we had 2,410 positive children identified in the ISDs, with another 1,463 staff cases. Each of those cases had approximately 10 close contacts. And because of the efficiency of identification of not only the positive cases, but the ability for the school systems to know where those children were in the schools and to be able to reach out to parents and let them know that their children had been exposed. And for those children who were exposed to be able to be quarantined at home until we could ascertain that they did not have COVID, that went a long way to reducing our number of cases in this county. We're dealing with the Delta variant, which has been shown to be much more infectious. It spreads as quickly as chickenpox does. It has a pre-symptomatic transmission rate that's been reported with high viral loads early on before a person develops symptoms. So that makes masking all the more important. And it also makes the identification of close contacts important because they will be able to be removed from the school setting, which is a congregate setting, and reduce the exposure to others in the schools. So I applaud your move towards masking, and it aligns with my recommendations and that of the CDC and the American Academy of Pediatrics and many other Texas pediatric groups alike. And my colleagues and I support you, and that's the end of my report.
Thank you, Dr. Walks. Trustees, do you have any questions? Trustee Boswell, then Trustee Singh.
Thank you, Dr. Walks. I appreciate this. I have a question about the positivity rate in 12 to 14-year-olds and 15 to 18-year-olds who are old enough for vaccinations, and also the data that you said you were seeing from spread during extracurricular activities, camps, and kind of all the things that happen before school starts with marching band, sports. I'm not sure exactly where the spread is, or if it's camps where children are going during the day. for other reasons. But I would love to understand the relationship between those things and the positivity rate in populations that are old enough to be vaccinated, and what that tells you about how we can keep those students safe as we return to school.
Historically, children have done well when they're in school or when they're with parents that are guiding their choices. But in the teen groups, particularly if they get away from the supervision of adults, we have seen peer pressure impact their choices, and they may end up wearing a mask when they start off in a given situation and then remove their mask. So some of that comes into play. And then this also is showing that we don't have enough of our children that are eligible for vaccinations vaccinated yet. So as we move towards encouraging not only our friends and family, but our colleagues and others to move towards getting them, not only their kids, but themselves vaccinated, I think that's going to help improve those numbers.
Thank you for that. And when you talk about compliance is higher with all the protections when adults are present, is that the curves that you showed us about the masking, schools with mask, without mask, and as compliance goes up, the curves flatten?
It's not, I mean, that does speak to compliance. But again, it really is a matter of guiding choices, and it's when you're in a situation where you don't, it's part of the rules, you have to wear a mask, it's going to be a lot easier to get better compliance with mask wearing.
Thank you.
You're welcome.
Trustee Singh?
Thank you so much for this excellent presentation. I have a few questions. Would you mind putting that slide back up that showed the number of pediatric patients that were in ICU? Thank you. And I just realized I can't see it because I don't have my glasses. but would you mind? So I think it was showing June, like last month versus it's showing June 21 versus July 21. Is that right? Okay. I was curious to know, is that the highest that we've seen during this whole pandemic, or was it higher at previous times, like around Christmas of last year?
I don't have those figures in front of me, but to my knowledge, this is higher than we've seen in previous surges.
Okay, I appreciate that. Thank you. And then when we had Dr. Myers come and speak with us a couple of weeks ago, I believe she had shared with us that only about 40% of 12 to 15-year-olds have been vaccinated. I wanted to know if you happen to be tracking that as well, and if there are any updated numbers.
I don't have the vaccination numbers with me today.
Okay. And then I've had a lot of parents asking and being concerned about long COVID. So even though we see there's an increase in hospitalization, would you be able to share a little bit of what you all are seeing here in Austin with regards to long COVID and the risks for that? And even what that phrase means.
We don't have enough data right now to make a determination on what the impact is going to be on our children overall. And the term long COVID is something that we're seeing not only in pediatrics, but we're also seeing it in adults. And it's manifest by things like chronic fatigue, memory issues, joint pains, some prolonged sequelae of shortness of breath, or, getting, and problems with lack of endurance. So it's going to take some time for us to gather the data and really quantify what that means and whether it's something that's associated with children who have some underlying medical conditions and what those might be, or whether it's something that's unique to the viral entity itself. It may come down that it's a combination of the two things. So unfortunately, this thing has been evolving faster than we can stop to do the gathering of data and really drill down on what everything is that we're gathering and what it all means.
Thank you. And I know, obviously we heard from the callers today a lot about masking. You've mentioned it as well. In our district, we have, I think President Rodriguez has said, we have 17 different layers of protections that we're implementing to keep our students and staff safe. So would you mind sharing where masking falls into the effectiveness of all the different things school districts could be doing to keep students safe? From what I've heard, vaccinations is the number one thing, but beyond that, what would you if you had to rank different interventions?
Well, the first thing that's going to be most effective for any individual is to not be exposed to the offending agent. And that's all we had when we started our fight against this virus. So ultimately, protecting yourself from exposure is key. We now have the use of vaccines to keep from being infected by the virus. And that's going to be great for people that are over the age of 12. But in the meantime, we have to protect those who are younger than 12 by decreasing their level of exposure, and that's going to be achieved by masking. So it depends on your risk. And in this case, the risk is highest for those who are under 12, and because they cannot be vaccinated. So for them, the number one protection is going to be masking. And not just their being masked, but for those who are around them to be masked. We've heard guidance from the CDC stating that if you're going to go to a home where somebody is immune compromised and unvaccinated, that you should wear a mask. And we need to protect our children in such a fashion by being masked around them in case we're asymptomatic carriers. And we need to put masks on them as well so that they can be protected from exposure to COVID-19 Delta variant.
Got it. Okay, well, thank you so much.
You're welcome.
Thank you, Trustee Singh. Trustee Lugo?
Thank you, Dr. Walks, for this information. I do have a question that I'm not sure whether you would be able to address or maybe point us to some information about. But some parents of younger kiddos have said, well, my child can't breathe with a mask. Now, I myself have a 3.5-year-old, and all she has known, all she can remember, is the pandemic. And at her
Excuse me 1 second. Let me close my door. Just a minute. Sorry.
No worries. So all she can remember is the pandemic. And she wears her little mask fit to her face, and she and her little classmates, who range in age from 3 to close to 6, wear their masks faithfully every day when they're in class. And so could you help me, maybe point me in the right direction? What does the research say about children and whether they can breathe with masks on?
They can breathe with masks on, and but if there's any condition that precludes their doing so, either they're too young, less than 2 years old, or they're unable to remove the mask, or in this case, it sounds like this child has some anxiety about it, but it's hard to say. Then if that's the situation, then that individual may not be able to wear masks. But, without knowing what the situation is and assessing it, I can't speak to what that particular situation is based on.
So, yes, so thank you for that kind of general response. And I think one of the things that you said that sticks out for me is that by and large, unless there's a health condition or some other extenuating circumstance, then by and large, children can wear masks and breathe through them. Is that?
Yes, ma'am.
Thank you.
Yes, ma'am.
Thank you.
You're welcome.
Thank you, Trustee Lugo. Trustees, any other questions? Trustee Zapata.
Okay, excuse me. My question is around what you stated about a lot of children or young people that that got COVID during the summer was when they were in extracurricular activities. So, do you think? We want our students to participate in extracurricular activities. With this new virus being more severe, is that something that we need to consider extracurricular activities only happening on their campus and not in big crowds? Because we will not be able to control everybody else that attends those football games or soccer games or any of those things.
We certainly are going to, it's going to be a challenge. I think that the previous trustee mentioned that her daughter's habit is to wear her mask and make sure that it's fitting correctly. It's going to be creating a culture where that's the habit and the norm until we get to the other side of this surge in this particular part of the pandemic. And so a lot of it's going to be not only requiring it, but instilling it as something that's part of the everyday cycle. Just as we're talking about making sure that we take breaks for hand washing, and heretofore we used to talk about covering coughs. Those became habits, and the proper use and wearing of masks is going to have to become a habit that doesn't require supervision.
Okay, thank you for that. Can you explain what you mean by contact tracing?
That's a process by where an individual who has been identified as having an infectious disease that's communicably transmitted or transmitted in our community is identified, and then we identify who has been around that person in close contact, which is defined as 15 minutes during a 24-hour period within a 6-foot distance. And those people that have been identified within that definition are contacted, and they're informed that they've been exposed. And then because of that exposure, we ask them to quarantine for a given period of time to see that they have not, that exposure has not caused them to be infected by the disease in question.
Okay, so you have the database of everyone that's already been infected?
It's reported, yes.
Okay, great. So if we have any new outbreaks in our campuses, you all get that information and follow to make sure that that's happening? The contact tracing is happening? Y'all do the follow-up?
We do receive the information. However, we receive reports as the data is entered, as the data is transmitted to us, and that causes a delay in the initiation of that, contacting not only the case, and then we have to contact the case, and that only happens maybe 40 to 50% of the time because people don't answer their phones or they're not available for whatever reason. So our contact tracing happens only as much as people pick up the phone and answer. And then they have to be willing to answer the questions that we're asking. Mm-hmm. So for us to do the contact tracing, yes, it is possible. However, when contact tracing is done at the schools, they know where the children have been. They know the classrooms that they've been in. They know the seating assignment. They know who's been sitting around the child that may have gotten sick. And that expedites the process. If we do what we did last year, we will be much more effective in containing the spread of COVID-19.
Well, that's very helpful. I think that's helpful for all the community to hear, and especially what you said, if people answer their phones so that we can get all that information updated, which is very important. Thank you.
You're welcome, ma'am. Thank you for the question.
Thank you, Trustee Sabata. Trustee Singh?
I have one more question. And again, thank you so much, Dr. Walks. We know that you have a very busy schedule, but I think probably one of the most important slides that you had was the one that showed the ICU capacity with different levels of compliance. Can I trouble you to put that up again? Because as we, as trustees, make decisions about layers of protections putting in, I want to have a really clear understanding of what impact the compliance level would have on the ICU capacity. And so I know we kind of whizzed through that slide a little bit, and I was just hoping that you could kind of talk through it just for about a minute or so with the I think it may have been that. Yeah, it was one of those two.
So,
yeah, what are the main takeaways that you would like for us to have from this slide?
If we wear masks in school and have high compliance with that we will be able to maintain our ICU capacity.
And I hate to even ask this, but what happens in the case where we exceed our ICU capacity, like you see with the status quo and moderate compliance?
there will be an issue with being able to provide care on some level, either increased wait times or having to divert patients to other systems, not necessarily in the state, because right now all of our major metropolitan areas are having difficulties with the same thing that we're experiencing here. So we may even be looking to out-of-state locations. And if resources are limited, then we have to make informed clinical decisions about who we triage as being critical and needing critical service and who has to wait for the care.
Okay. Thank you very much.
You're welcome.
Thank you, Trustee Singh. Trustees, any other questions for Dr. Walks? Trustee Wagner.
No particular question, but I just did want to thank the doctor for spending time with us this evening, particularly with as full as your plate is right now. It's very helpful to have the latest facts and statistics, so thank you very much.
You're welcome.
Thank you, Dr. Walks. I don't think we have any other questions. Okay.
Okay.
We appreciate your time and
Thanks.
appreciate everything you do for our community.
Thank you, and thank you for standing up and having this conversation. I appreciate it. Thanks.
Thank you.
Bye-bye.
Trustees, we will now recess the open meeting at 8 o'clock and move to executive session pursuant to Texas Government Code Sections 551.074, 551.072, 551.073, 551.087, 551.076, and 551.071. For purposes of this video meeting, the board will now leave this open meeting, which will remain live online and convene privately in a separate meeting. And when we're finished with our executive session, we will reconvene here. And again, we thank our community for their patience. We will now reconvene the open meeting at 9:52 PM. Our next item is an opportunity for the administration to provide an update on our current safety protocols. This board recognizes the importance of layered safety, which includes the correct usage of masks, washing hands, social distancing, quarantining when you are exhibiting symptoms or have had exposure to a positive case while unvaccinated, and of course, receiving a vaccination if you are eligible and able to do so. These protocols are especially important for the protection and health and safety of our youngest and most vulnerable students who are not able to be vaccinated at this time. Dr. Elizalde?
Thank you, President Rodriguez. Members of the board, I would like to just remind everyone of a few of the layered protocols that we currently have in place. Our goal has always been, and will continue to be, that we follow the recommendations and the guidance based on science by the Centers for Disease Control, also known as the CDC, the American Academy of Pediatrics, or AAP, and of course, our Austin Public Health, or APH. This evening, we were fortunate to be able to hear from Dr. Desmar Wachs, our local health authority here in Travis County. So in keeping with that, as you all know, and we have been messaging many of the protocols that include things like social distancing, we'll have seating charts, we will continue to contact trace, we will continue to expect quarantining, isolation with positive cases. We will keep our COVID dashboard. We will continue to keep it updated daily. We will provide notification. We've increased all the filters to the highest level possible with our HVAC. We've added air purification in each and every classroom. We will begin again our rapid testing both on site at each campus. We will also conduct drive-through opportunities, as that was helpful last year. We will continue to utilize as many outdoor spaces as possible. Even when utilizing the cafeteria for possible meals, it will not be the only place. So we will have some students in pods, isolation in the cafeteria. Some students will be eating in the classroom. Some students will be eating outside. Our role here is to maximize the use of space. We also will continue the self-screening for those individuals who want to utilize that at home. And as you all know, we have expanded our and actually implemented our virtual learning for K through 6. Given all of those measures, there is still one measure that, as we heard from Dr. Wachs, is the most helpful in mitigating this terrible pandemic. That happens to be that of mask usage. And I recognize that in a society where interests conflict, there can be no absolute response that will rest with all of our constituents or stakeholders. That being said, I am responsible for the safety, the health, and welfare of each and every one of our students and our staff. And if I err, I must err on the side of ensuring that we have been overly cautious, not that we have fallen short. And therefore, I am announcing that one additional COVID protocol will be that we will require masking of all individuals, all visitors, on all district property at campuses and at any other district offices, effective Wednesday, August 11th. This will provide our team enough time to communicate with our stakeholders, to communicate with our campus leaders, our principals, our directors, so that we will have a smooth transition of ensuring that when we mask up, we save others. It is very difficult to make these decisions, and yet not difficult when we think about what some of the consequences can be. So our expectation is that last year we were able to implement required masks, and everyone worked with us regardless of their thoughts or opinions because we put our children and our staff first. And I'm asking all of us to do that once again. And we are here to serve our students and to ensure that all are safe. Thank you.
Thank you, Dr. Elizalde. Secretary Singh, do I have a motion to adjourn the meeting?
So moved.
Is there a second? So having a motion by Secretary Singh and a second by Trustee Zapata to adjourn, all those in favor, please raise your right hand. And the motion passes by all those on the dais. And this meeting is now adjourned at 9:56 p.m. Thank you.